Thank you, Jeff. Am I holding it the right way? No. Can you hear me?
Yes.
I'm so grateful, first of all, just that you're here and you're healthy, your family, and that you've chosen to tell your story. And in some ways, I feel like between Mary, Lori, and Jeff, I don't know how much I actually have to add, because I think you've covered everything so well, but I will try. And I think the most important part of the rest of this time is for questions from you that we'll try to answer. So we do get out of here at 1. I'm going to try to talk for maybe 15 minutes. They're going to try to keep me on time. If I go a little bit over, I promise you I will stay around past 1 if we haven't answered questions. We're not going to be able to stay around much past 1 because we've got to get on an airplane. Which brings a question to mind. Okay, Andy, why did you travel 1,624 miles to come talk about healthcare? And unless she's here, it's in part because Representative McSally isn't. We know how gung-ho she can be because we've read her comments. And I think I chose to come here at one of my first visits because, quite frankly, I found her comment to be representative of the fact that for some people, this is a game. It's a sport to be won or lost. And that bothered me. And look, we're not going to agree with every vote a representative takes, but one would hope that a representative will at least explain it to us, answer our questions, hear our feedback. When that doesn't happen, I think that bothers me. Now, I grew up in Chicago. I lived and worked in healthcare for my entire career until a few years ago when I joined the government to do public service. These were the best years of my life, best experience of my life, because every day I woke up overseeing the Medicare and Medicaid programs and the ACA and the Children's Health Insurance Program, and I knew that there were 130 million Americans, many on tight budgets, many with low incomes, all of whom in the most vulnerable times of their lives counted on the healthcare system. And we couldn't always get it done, but I felt like every waking minute there I was doing something really valuable and important. And so I still feel that way, and that's why I'm still doing this, because our healthcare is so personal to us. It's not a game. And I want to say this, important, it doesn't matter if you voted for Donald Trump, or if you're a fan of President Obama. It shouldn't matter. Nobody should be required to say, I want to make the healthcare system better, and then make a choice that says, this is my political affiliation. It's not about that. And in point of fact, we have to rescue our own healthcare back from this political battle where people hold it over our heads. If this passes, and I'll talk about some of the impacts, people are going to be in a lot of pain and a lot of misery, and we're going to all wait for the next election to pull it back and back and forth we go. We've got to stop that. That's not good for anybody. It's not good for the country. It's not good for us. And this is essentially what this is all about and what we're doing. So I want to try to give you as much that is not political, but that's as fact-based as possible. I will try to tell you when I'm giving you my opinion, and I'll try to tell you when I'm giving you things that are facts. And of course, you can reach your own judgments about whether or not you believe what I'm telling you or not. That's perfectly appropriate, understandable. I don't have a monopoly on any of the answers here, but I was close to it. And here's what I would tell you, having been in healthcare for as long as I was, for many, many, many years, we were not making progress in our country. Things just weren't changing. In 1965, we passed Medicare. Was Medicare perfect? Is Medicare perfect? We just heard it's not perfect. But what we do know is that before Medicare, before there was such a thing as Medicare, 1 out of every 3 seniors in our country lived below the poverty level. And today, that's a dramatically different picture. It's far less than 1 in 10. So these kind of changes don't happen very often. When they do, they can be quite dramatic. And in the case of the Affordable Care Act, it accomplished certain things. One of the things it accomplished was it gave a lot more people insurance and a lifeline of financial security. So we know that 20 million new people gain insurance, but what's also interesting is that the number of people that say that they worry about a medical bill that they can't pay has dropped from 21% to 16%. Now I'd like to see that 4%, or 3%, or 2%. But that's a progress considering that we've been at this for 5 or 6 years. The number of people that are going to a regular physician has increased. The number of people that report being able to afford their medication has increased. The number of people, and I can't measure this, but I know this from anecdote, the number of people who allow their families to participate in sports and events and things where they could get hurt and injured has gone way up. The number of people that can leave their jobs because they haven't been worried about insurance has gone up. So a lot of progress. Now, didn't cure everything. Oh, and by the way, provide a lot of protections, things that we just talked about, things that Jeff just mentioned, like the elimination of pre-existing condition protections, the elimination of caps on policies. All those things became illegal with the ACA. Requirement that every insurance policy isn't a bunch of Swiss cheese that may cover this, may cover that, you find out later. That got wiped out with the ACA. So those are all good things. But in any fair telling, there's good and there's bad. And one of the reasons I went to Washington is to have as much good as possible, and hoping that in the spirit of it, that even people who didn't vote for the law would say, okay, if 70% of it works, let's get to work on the 30%. So I'm going to tell you what I think some of the 30% was. For one, I think there wasn't enough of a tax subsidy for people who were middle class. There should have been more of a tax subsidy, and there still should be. Two, there's not a real good method for enforcing competition. I spent a lot of the last couple of years calling insurance companies up and begging and pleading them and saying, please come into this market where it's very rural and not a lot of people are and offer insurance. That's not a method for our country. I think we would have ideally liked to have something like a public option, like in Medicare, where you've got a Medicare Advantage option and you've got a Medicare fee-for-service option, so we could be assured we'd have enough competition. And thirdly, well, what I think wasn't planned on was that instead of people in Washington going to work like we expect them to do to make things better, that there are a bunch of people that went to work and said, we're going to tear this thing down. How did they tear it down? A number of Supreme Court cases which stopped Medicaid expansion in 19 states, 3 million people without coverage, set the prices much higher. How else did they stop it? They took $8 billion that the law required to be spent on something called rate stabilization. What is rate stabilization? It's exactly what it sounds like. Keeps the rates low in the early periods. Well, one of the people running for president very proudly said, I got that defunded. And that's really going to hurt the ACA. And it did hurt the ACA. It put a number of small companies that were set up to be in rural areas out of business because it took money that was coming to them. So it wasn't perfect. Things need to be fixed. No question about it. And when I left office, I said, look, what does the American public want? Clearly, President Trump got elected and a number of Congress people got elected by saying the words repeal and replace, repeal and replace, repeal and replace. Okay, so what does that mean? Turns out what people meant when they heard repeal and replace was, oh, you're going to make it better. Okay, I like that. I don't think people, when they heard repeal and replace, thought, oh, you're going to make the deductibles higher, you're going to make the premiums higher, you're going to take away the pre-existing condition preference. That's what you mean by repeal and replace? And in very large numbers, the American public is saying no. That's not what they wanted. I said when I left, and I'm not sure I made friends saying this, but my job isn't making friends, was if the Republicans or the Democrats put forward any proposal, I just got 5 minutes and I got like 10 left, so I'm going to figure out how to struggle here, sorry. Is how do we take that and accomplish more of the goals, cover that last 30%. And I set up 4 criteria. Cover more people, better benefits, more affordable, and do it in a way that's fiscally responsible for the country, we should all applaud it. We've got a really interesting country. And if a Republican turns around right now and puts something like that on the table, I would be the first person to walk around to town halls like this and say, this is good. So what I'm here to say is not political. What I'm here to say is, what's the actual impact of what's on the table? I think Jeff laid it out quite well. I'll go to 3 promises that the president made. 3 promises, and these are almost entirely his own words. The first promise he made was nobody would lose coverage. He said nobody will lose coverage. Well, the nonpartisan Congressional Budget Office says that 24 million people will lose coverage. Now, that number may not be exactly right. That number may be 21, maybe 27, maybe 19, maybe 18. I can tell you for sure, based on my analysis, the floor is some number above 14, because 14 million people would be wiped out for Medicaid alone. So, at a minimum, maybe it's 20, 24 is, I think, a middle of the road number. But it ain't 0. It ain't 0, which is what he said. The second thing he said is, we'll have insurance that'll be a fraction of the cost.
Fraction of insurance.
Right, fraction of insurance. So, just the simple math on this is, this proposal reduces the tax credits pretty significantly, and then readjusts the curve so that younger people pay less, but people who are 50 and older, not 50, so whatever, have to pay 5 times as much as what younger people pay. The AARP calls this an age tax. So it's not less expensive, and then if you live in a rural area, if you're older, it's even more expensive, to the point where the average person who is in their 60s would be paying half their income in premiums. And then furthermore, deductibles, which I think we all think are too high, would go up by an average of 60%. So that's that impact. And then the third promise he made was pre-existing condition protection. We're going to keep pre-existing condition protection. Now I will tell you, I've been on a lot of news programs where I've been asked the question that I never thought I'd been asked when I was a kid growing up, which was the following: is the president lying?
They all lie.
It's an awkward question to try to answer. And I think what I said was, unless he knows a fact that no one else in the universe knows, maybe it's not true. I think that was my artful way of answering that. But I'll tell you this. He said, no, this doesn't take away pre-existing condition protection. On the House GOP website, there have been the words that said, nobody with a pre-existing condition should be charged more than anybody else. After the House vote, that sentence was eliminated. That's all you need to know. The federal protection is gone. Now, it's what I call a high five and a wink. The high five is, hey, we got this done. The wink is that they didn't actually take away the pre-existing condition coverage. They just took away the protections. So they can claim, go on TV news, and with apparently a straight face, say that they did take away pre-existing condition protections. I don't know any other 3-letter word besides lie for that. What else has happened in this bill? This bill is not really just about these changes. This bill, at fundamental level, if I were to describe it to someone in 20 seconds or less, it takes $1.2 trillion that is going to be spent on health care for people in the lowest 40% income brackets, people on Medicaid, and people who are receiving tax credits. $1.2 trillion, and it stops that spending, and instead, it creates a tax break of near close to the same size for the following people. Well-off individuals in the top 1%, so if you make $1 million a year, you get a $55,000 tax break. Anybody? Congratulations to you. Insurance companies, pharmaceutical companies, medical device companies, and tanning salons. So $1.2 trillion that would otherwise have been spent on people's care. And in the state of Arizona, very specifically, where Medicaid expansion has been such an enormous part of our economy here, 430,000 people got covered by Medicaid expansion. Medicaid expansion would be wiped out over the next couple of years, so those people would lose coverage. 600,000 people have gotten covered in total in Arizona. There'd be several $1 billion that the federal government currently gives to the state to pay for these things that would be eliminated, creating a budget hole. And then the number one sector for jobs in the state is healthcare, 350,000 jobs. So that money goes right to their paying for those things. So one of the reasons why this is not a partisan issue, Governor Ducey has been very clear he's not happy with this. Now, we're going to close now and then open for questions. I'm going to close with the following. Get asked a lot, well, what should I do? What should I do? Here's an interesting opportunity. Let me start with this. It ain't over. It ain't over. Anybody who tells you this is over hasn't met the moms that I've been talking to on Twitter, moms of chronically ill kids, moms who have kids with special needs, people who, like you heard from today, who are in communities that are getting taken care of here. They've been fighting their entire lives for these things. They don't quit. So I know that I can't quit. Well, you should quit. So what you do? Here's the good news. If there's good news. In the Senate, there's a 52-48 split. And if people vote down party line, I can't imagine that there's not going to be a Democrat that's going to vote for this. So, Leader McConnell, Majority Leader McConnell can afford to lose 3 votes. He can't afford to lose 2 votes. He cannot afford to lose 3 votes. And guess what? There are a couple of people that are probably no votes. That means that if either or both Senator Flake or McCain were to stand up now and say, I'm not voting for anything that takes $1.2 trillion away from people's health care for a tax break. I'm not voting for anything that takes $1 away from people's care for a tax break. Everything will change. So as soon as a senator has the courage, a swing senator, and I think those 2 are in that camp, has courage not to say, oh, I don't like the House bill, or some kind of non-committal answer, something that allows them to have it both ways around the line. But as soon as someone says, I will not vote for this until this is out, then that will change everything. And then we can go to work on fixing the things that need to be improved, which I think we should do. Anyway, I went a little bit long. I want to go to Q&A.